The Sikh Human Rights Group proudly presents our Neurodiversity speaker series. Today's topic, the challenges and barriers that those with autism face whilst finding, obtaining and retaining employment. Today you'll be listening to Ms Dianne Malley from Drexel University in the United States of America. Dianne directs the Life Course Outcomes Transition Pathways Initiative, a collection of innovative efforts to improve outcomes for young adults on the autism spectrum. She has years of experience developing family, school and community partnerships to improve the outcomes for children. Dianne has an extensive background in developing partnerships and collaborations with state agencies, schools and communities to improve the authentic engagement of parents in their child's education. For the last 10 years, she worked at the Statewide Parent Advocacy Network, otherwise known as SPAN, a non-profit organisation committed to empowering families and advocates and partners in improving education, health and mental health outcomes for children and youth in New Jersey. During her time at SPAN, she led a number of initiatives that supported the inclusion of students with disabilities to improve college and career readiness, developed family and community partnerships to support students with learning and behavioural challenges, increased family resources and developed efforts to increase the capacity of parents as leaders in their communities to create positive change. She received a Master's in Fine Arts from the State University of New York at Buffalo and has completed a certificate in non-profit management from Non-Profit Center at La Salle University School of Business. Dianne is the mother of 3 daughters. As a parent of a young adult with a developmental disability, she has direct experience with the multiple systems that impact children with special educational needs and their families. Her personal experience advocating for her daughter to be included in her school and the community fuel her commitment to promoting inclusion for all people. So Dianne, with that being said, thank you so much for joining us today.
Oh, thank you so much for doing this series. It's so important to hear from many different perspectives around neurodiversity and the world of employment. So I really appreciate being invited.
You're most welcome. Dianne, could I please ask you to begin by telling our audience a little bit about the invaluable work that you and your colleagues are currently undertaking in the States?
Yes, absolutely. So I will just say, how I ended up there as well. As you pointed out, I'm a parent and a professional. And so I always sort of bring both hats to what I do. And that's how I've ended up in this current position after years of working in an advocacy organization that really, I was there and advocating for my daughter all along the way. And I sort of graduated from school with my daughter. And so the work I'm doing now at Drexel is much more focused on those years moving from education to adulthood and employment. And it's the same journey my daughter's on. So I'm really honored to be able to be working in this position now. And Drexel University is in the city of Philadelphia. And it's an academically comprehensive, globally engaged urban university. So we are in the heart of Philadelphia. We are not up on like a hill with, beautiful surrounding. The city sort of intersects with our campus all throughout it. So it's a little bit unique like that, as many universities are sort of the Ivy Tower up on the hill. Drexel University is also globally known for their cooperative education program, which means that students actually, after their freshman year, they work half of the year and go to school half of the year. It's a unique model in the States, at least, and they have been known for that for about 100 years, and we call it a co-op system. And so it puts Drexel University really aligned with the business community and the world of work, because students spend so much of their academic time actually working, and they can work anywhere in the world when they're on a co-op, and they often get paid for that co-op and then come back to campus for the next 6 months to do their work. So again, we're in Philadelphia, we're urban university. And I like to also tell people that the current president, President Fry, his mission for the university is to be the most civically engaged urban university in the nation. So where we're situated is right in that area is what in the States they call a promise zone. And that is an area of very high need and poverty, but great potential. And the promise zone often it's a designation that sometimes brings in additional funding and focus. So we're in the thick of all the challenges and problems and opportunities that, you know, these high poverty urban areas present, and that's sort of where we're situated. Now, within the university, we are blessed that one of the focuses has been autism, right from the president, our current president, and that's where I'm situated. It's the Drexel Autism Institute. So we are a research institute housed within the university. And it's also interesting to point out that we're the first research organization to apply a public health science approach to understanding and addressing the challenges of autism. And this is somewhat unique in the world of autism, a public health approach. Drexel also has a major school of public health, so these things sort of all align. And we always maintain, what that does is it maintains a population perspective by always looking towards strategies with the broadest potential impact, or an explicit focus on groups in society that are otherwise underserved or overlooked. So that gives you a little bit of where we're situated. Now, within the, you know, when you work in a big university, you're like, there's the university, your institute, and then the program I'm part of is life course outcomes. And that's the research arm that has been looking at things other than clinical interventions that will lead to better outcomes into adulthood. And most of the research for autism is spent on the early years, even though individuals spend the majority of their life in adulthood. And so this has been an underfunded, under-focused area, like what will produce better outcomes into adulthood. And I was hired by the researcher at the time, Paul Shattuck. He has since left and moved to Mathematica, but his team really did some groundbreaking work around setting, like, what are some indicators we should be looking at to measure how people are doing into adulthood. And I can send you some links after this. And what they did was they put together these indicator reports in very visual, accessible ways so people could really start to see. And what they found was that across many different measures, people who are autistic were not faring that well. And this was really alarming to really see this. Like Paul Shattuck talks about creating a dashboard, you know, to really know how things are going, and talks a lot about how we're going to move the needle on these dashboards to really improve outcomes. So, so at one point, the president of the university, President Fry, and Paul Shattuck, this sort of rock star of autism research at the time, were talking. And the president said to Paul, like, you have pointed out like some pretty grim, you know, outcomes into adulthood. What are you going to do about it? So Paul always says he was given a challenge, right? Like, you know, and that's where the project I have had the honor to direct was born, Transition Pathways. So I always say I'm in a university and I'm in a research institute, but I'm not faculty and I'm not a researcher. I'm trying to make something happen in the world. So we really have looked at, you know, what the research has pointed out as the most problematic areas, and then what some potential best practices, evidence-based practices are. And then we try to make something happen in real time on the ground in a city with all sorts of challenges, including a pandemic thrown into the middle of it. So that's the project I direct. And so I really took this job because the job ad said we want the Transition Pathways was to be an innovative incubator. I thought, oh my gosh, like that happens so rarely that you have funding to try to innovate in sort of this world of services and so on. So you know, we are really aiming to come up with approaches for autistic young people to achieve a successful transition to adulthood and reach their full potential. And we're called Transition Pathways because what the research showed is that this period between exiting high school and entering young adulthood, many autistic people just sort of fall off a cliff. In the United States, we talk about it as like a service cliff. So many people will have received some services in school, They may be receiving special education services, other supports, and then they exit school and literally it's like they fell off a cliff. There's nothing on the other side if there's not real intentionality of connecting all the educational system with these adult systems, workforce systems, and others. So that's why our initiative is called Transition Pathways. And what I found as soon as I started here was that we were in Philadelphia and we have a lot of young people who autism is one of the barriers that they face as they attempt to enter adulthood, but they actually face multiple barriers as a result of systemic ableism, racism, and poverty. So we have very much tried to work in this intersection of where all these barriers arise. And we often find it's the autism is just one of those barriers. It's not the only one. And many of the evidence-based interventions that I have examined and I looked at when I was new in this job didn't really relate to the folks that we were seeing who had the intersecting challenges of multiple identities. Like, you know, which identity is most prevalent at any moment to address the barriers. And the autism interventions often were we felt relevant when that was really your primary and only, you know, barrier. So we have tried to be responsive and innovative in how we really address multiple barriers. So, you know, with that said, and the pandemic thrown in and everything else, we really try to recognize that neurodivergent youth with intersecting identities face these multiple barriers, and that's what we're trying to address in many, many of our programs.
Thank you very much, Dianne. That was extremely interesting and very thorough. I think the only commentary that I have kind of arising out of that is I'm glad that you referred to the support services for between youth and adulthood. Youth very much falling off a cliff. Through our current work in the United Kingdom, we often refer to it in the same way. There just seems to be a lack of support focused on higher education, employment, and so on for neurodiverse individuals once they reach a certain age. And that's not to say there aren't support services available to help them. It's just that there needs to be a bit more of a focus now, I believe, on enhancing those services and also distributing them both domestically in the United Kingdom, but also internationally across various countries. So yes, with that being said, Dianne, my first question to you, and obviously today's focus is going to be around the employability section of neurodiversity, and that is, through your various projects and experiences, what have you found to be the greatest challenges and issues associated with those with autism finding, obtaining, and crucially retaining employment in the current US market?
Yes, wonderful. So yes, this connection from school to adulthood is so crucial, and it's primary in everything we do. But so what we find, we have focused, really hyper-focused on employment, because we feel that employment is the bedrock of adulthood. Like I have, as you said in my intro, I have three daughters in their 20s, and a couple, they're all living in my house right now because they need, you know, self-sustaining jobs to be able to live independently. And that's as true for my daughter with a developmental disability as it is for my two neurotypical children who may be moving out very quickly. But so a lot of people wanted to talk about independent living first. And we're like, that's really not the way it works for most people. You need a job before you can support yourself. And when I started, our economy was going blazes, right? Like we were just at like full employment almost. And of course, the pandemic hit in the middle of all this, which has shaken everything up. But so we really have hyper-focused on how do we get young people prepared and transitioning to either education, further training, or directly to employment. And for many people, not all, but many of the young people we encounter in Philadelphia, it is a direct connection to employment. So what we find is that neurodivergent people bring incredible strengths to the workplace, but may have difficulty navigating the complex environments of work, the abstract rules, social norms, and all of these often can lead to loss of job and disengagement from work and careers. And what we also find is that existing employment services are often unable to effectively support neurodivergent workers. So in the States, there has been a lot around supported employment for individuals with an intellectual disability, typically defined, I mean, we know this is problematic, but around IQ and IQ under 70 is what we often think of that. And for people who are autistic or neurodivergent, and I use a lot of these terms back and forth, those services don't always hit the mark for them. Many times individuals can do the skill of the job, but they need coaching around executive functioning, workplace soft skills, the social norms and things like that. So that's, what we find generally. And we also find that, I just wanted to give you a few numbers and so on of why this is so important. In the States, in the next decade, over 700,000 autistic young adults will graduate from high school. That's a huge, staggering number. And right now, like many parts of the world, United States, we have this war for talent, right? That we have more jobs than there are people seeking to fill those jobs right now. But I always say, if a company hasn't intentionally created a plan to tap this untapped labor pool, there's a miss. Like, we can't, as a nation, any longer ignore, the staggering numbers coming at us. And again, one of the biggest problems we find is this transition. So in the States, high school ends at 18 if you're neurotypical. If your team decides you need further, oftentimes someone with a disability can stay till 21, stay a couple additional years. So that's the exit from school years. It's anywhere between 18 to 21. But what we find is at least 37% of autistic young adults become disconnected from both employment and further education after graduation. In Philadelphia, this is not a phenomenon only for autistic young people. Generally in the city, they talk about opportunity youth, a nice euphemism, right? And that's 16 to 24 youth in the city who are disconnected from education or employment. So we know there's other folks experiencing this as well. But also what we know is if we don't intervene and make connections while people are exiting the school system to what's next, it becomes harder and harder to reconnect people, right? So that's a big focus, not our only focus, but that's a big focus, trying to make those pathways connected, real, in real time for individuals. We often say, ideally, if you're leaving school and the aim is to be employed directly, we want the last day of school to look like the first day of employment. Like, you should already be in that job on the last day of school with all the supports and so on. And so, the next day looks exactly the same. That's the ideal. That it doesn't always happen. And the challenges are, we know that all too often, people are still regulated to low wage and part-time jobs. So I personally want the day that when someone says to my daughter, oh, where do you work? And she says, I'm at, the realty store in my town. And they'll say, well, how many hours do you work? And she says 8. People will not have to ask if that's a day or a week. Right. So in the States, we often have clapped and said, we're done. People have a few hours a week. Isn't that nice? We've hired the disabled person, and they go off and think the job has been done. And what it does is it regulates people with disabilities, autistic people, neurodivergent people to poverty, and reliant on public systems for the course of their adulthood. And what we also know is these outcomes are even worse for neurodivergent youth who are Black, Indigenous, or people of color, and particularly then when they're from low-income communities. So these things are all magnified. So again, it's this move between the two things that we really want to look at. One of the things that's unique about us, I think, and our focus is we've spent a lot of time, because we knew about this transition period, and we know the numbers and the data around how poor these employment outcomes are, trying to get individuals sort of career ready, getting them prepped and supported and so on for employment. But the missing piece is you also have to be getting employers ready, right? Employers need to think about doing things differently, and employers need to build capacity as well. And there's some greater appetite for that right now, as the labor market is so tight and there is this war for talent in the States, particularly in entry-level jobs, but in many positions, people are jumping jobs for $1 more, $2 more an hour, and staying, the turnover rate, we talk to companies, is enormous, and turnover costs companies. What we also know from data is that people with disabilities often stay in jobs for are loyal labor, and they stay way longer. So we're really working on, we decided that we can't focus only on the pipeline of talent, but we have to work from both ends. And that's been a lot of our focus. And you might notice too, not only have I talked about neurodivergent people, autistic people, but I've thrown in disabilities as well, right? When it comes to working with an employer, we almost never just say, we will source talent for you for autistic people or even neurodivergent people. We think that perspective actually reinforces a lot of stereotypes. So, people end up thinking like, oh, autistic people are really good at a set of skills. And what we'd like to say is that we want to see autistic people, people who have experienced neurodivergence and other disabilities in every sort of industry and every sort of position within a company. So it should be vertical that people think about hiring, not just entry level, but actually all the way up to CEOs, all the way down to entry level positions in every industry, because we know that autistic people have as varied strengths, interests, aptitudes as a general population. So we really try to shy away from this just like autistic employment or autism at work or neurodiversity at work, and also build on the history of the American with Disabilities Act in this country and other work that has been done about getting people with disabilities into the workforce and supported there. And then, the other big challenge is that so if you have in Philadelphia, particularly, and Pennsylvania, the types of supports that someone can get vary state by state in our nation. So it is not a federal thing. I live in New Jersey, but I work in Pennsylvania. My daughter gets a little budget for supports. Getting that same thing in Philadelphia is a whole different process, all different systems. And what we do know is that many times people who are autistic, part of the challenge is they drop off from that school age and they do not qualify even. You have to qualify for adult services. It is not an entitlement like education is. And the process of qualifying for adult services is incredibly complex and very hard for families to navigate on their own. No matter how educated and how empowered you are, it is very difficult to navigate. And oftentimes they don't qualify. So many times autistic people need some often light but longer term supports in the workplace, like maybe the job tasks change, maybe supervisors change. There's, no workplace is static, and they may need temporary supports. They may need supports with social norms throughout, and there's not necessarily funding that follows the individual in all cases to provide that support. So again, part of what we're trying to do is build the employer's capacity to think about what could that support look like from their end, and not always depend on the person bringing that with them.
Thank you so much, Diane. That was extremely insightful. I think there's so much that I could say coming out of your comments, but I think what I was going to say was my next question to you was going to be what can or are the benefits of employing those with autism? But I think as this podcast series progresses, I think the focus now has really shifted away from these blanket statements, these generalizations around neurodiverse individuals. Everyone is very much an individual, and therein should lie the focus. You have covered things like the retention rate being a lot higher, perhaps for neurodiverse diverse individuals, but by no means is that solely applicable to neurodiverse individuals. There may be other talent sectors from neurotypical people in certain industries where they're more likely to be retained for various other factors. So I won't ask you that question if that's okay. I think we've covered it quite well already. So my next question to you is how can employers ensure that their recruitment and interview processes are made more accessible to those with autism, but also other neurodiverse individuals as well?
Right. So we do a lot of training for employers, and it's not a one size fits all process. We very much try to, let me just back up a little bit. So what a lot of the things that we've done is for transition pathways, we've created a number of school to work transition programs in collaboration with the School District of Philadelphia. School District of Philadelphia is might be the third largest school district in the nation. It has every challenge you can think of. Like last fall, they were out of school for almost 2 years after the pandemic. When they got back, there were no bus drivers, there's no aides, and it is incredibly challenging. And what we were seeing is that students were just like leaving at 18. Families were coming and saying, they can't go back there for one more year. Nothing, is happening. So we've been working in really deep partnership with them. And we have a number of school to work transition programs that are off campus, where they really focus on career skills, mentoring, and real job experience. So we bring in employers for internships and so on while the students are with us. So the employers start to learn a bit about this process as well as the students, and we can do lots of support along that way. But again, as I said, we knew this wasn't enough. So we started what we call the Drexel Business Inclusion Center, and that's our arm that works with businesses. I'll also just add, everything we do is in collaboration with multiple partners. So the school district really funds the teacher, the aides, runs the students, plans, etc. But we house the program at Drexel. We house a program at a community college. We sort of convene all the people who need to get together to make something happen. So for the Business Inclusion Center, our partner is an employment agency partner, and they've been in Philadelphia for 30 years, supporting individuals with disabilities solely in employment, and some 2,000 people a year, one by one, getting them jobs, providing job coaching, job development, etc. So they're our arm. So we're able to wrap all the supports that an individual may qualify for around that individual, and then we'll come in and do the work with the business as well. So just to give a little context, and so what we're trying to do in the world of disability employment is move from this one by one model and get companies to think about people with disabilities as a talent pipeline. And there's other talent pipelines that companies are also tapping into: re-entry. So individuals who have been incarcerated and are coming back to their communities, that's a population that needs support while they're getting back to employment. Immigrants often need a little extra support. There's numerous populations. So disabilities, where people with autism and neurodivergence often fall into, is just one of them. So that's the kind of work we're doing with a number of partners. So we try to bring the business on kind of as a partner, and we help them to recognize that there are tons of benefits, and we talk about the ROI for the business. What is the actual return on investment? And a lot of it is loyal labor, reduced absenteeism, hyper-focused productivity in some instances, etc. And then we try to talk to them about, what are their systems, their rules, their policies, their culture, right? And because one of the biggest things we always hear is, well, first we say to businesses, like, you're already doing this. There's neurodivergent, autistic people and people with disabilities. If you're a company of any size, they're there. Like, we know one in every 4 people in the States probably has a disability. It's the one minority group you can enter at any point in your life that you're not born into. So we try not to make it so magical that they think they're not doing it already, but they'll say, well, nobody self-discloses. So we say, well, what's the culture in your company? Why would someone disclose that they have autism? Like, they have to feel that there's going to be a greater level of support by disclosing than hiding that and trying to pass. And so that's where you start the conversation of culture with an organization. And we have lots of things we will work with a company to do. So it may start with updating language on their website to make sure that they proactively communicate that they are an inclusive company, that they're a company that respects and values diversity, including disability, because there's a huge focus on diversity, equity, and inclusion in the States. But you know what? When we talk to companies, they may be measuring how many people of color, how many, what equity is, but they're not thinking about disability as part of that often. So we try to embed it into the ways that they're already thinking about equity issues, because disability and autism and neurodiversity is an equity issue. And so we try to not make it a standalone thing, because that's like, we want these things to be incorporated into the heart and soul of what the company does and what their business as usual is. So an easy way to get started for a company after they've looked at their website is to also look at their job descriptions. And they need to say very clearly that the company has a commitment to hiring a diverse workforce. And we give them sample language that includes neurodiversity and disability in that. And then we ask them to consider making distinctions between skills that are required and preferred. So, really getting down to the exact required skills, because sometimes autistic people have, not always, but are really great at some things, but not, as we all are, but it may be more magnified, right? So let's really be clear on what the required skills are. Also consider avoiding vague language, right? Ability to work in a team environment. Well, what does that really mean? Like, how big is the team? What kind of work are you going to be doing, etc. And then we suggest that they consider partnering with community partners, because often they'll say, well, nobody applied. So you have to stretch where you recruit from, and oftentimes it does necessitate making partnerships with people like ourselves or others, so that they are more embedded in the community. So a lot of times we can get candidates to a company that people are never going to respond to their job ads, because companies don't realize all the little barriers that exist. Like, for instance, on our campus, a big global company that does food service on many campuses will have a hiring event for many locations in the city. So first off, they put out ads a few places. How does that really get to, the young person living way across the city, 20 years old, thinking, I need a job? So we contact that young person. That person doesn't necessarily know how to travel from their home to this location across the city for one time. So we send a job coach, meet them at their home, get them on public transportation and get to there. And then we hang out and we support them on that, through that job interview, through that process. And then we also follow up with them afterwards, because maybe they didn't answer their phone when they didn't recognize the number of who was calling them, or they didn't answer all those questions right, and so on. So we sort of do both the work on both ends. And that's where businesses need to connect with community partners who support people more directly. We talk a lot about individuals needing more of an on-ramp and to get to the door. And we find that on-ramp is absolutely crucial, because people just don't make it to the door of these opportunities without that. So we also do training for companies around what an inclusive culture and inclusive workforce looks like. How can they make their, we call them the hidden rules of the workplace. So all those things, like in our offices, if someone's door is closed, we work in a research institute, it means do not bother me. Don't come knock on my door even, like I'm not accessible. But there's no sign that said that. That's just something we learned. It's one of the unspoken rules. So for people with autism, oftentimes if we can help a company identify what some of those rules are, articulate them, and make them less hidden, that helps people succeed a lot. We train employers on having very clear directions and feedback. So we had an instance where we were working with an employer, they had done some training. We had a couple of young people coming through for an interview, and we'll work with an employer on a working interview. So show people really what the job looks like, give them a chance to display their skills, than to rely only on a verbal interview, which is still historically often used. And so they were doing that in this instance. And they said to this young man, like, here's the job. We want you to do this, this, and that on this machine. Can you do that? And so the young man said, no. And they came back to us and said, well, we can't hire him. He told us he can't do it. And we said, did you ask, could you do this if we trained you? A very different question, right? So we try to train, managers and employers around being very clear with directions and feedback. And when they learn to do that, it'll help everybody, right? Like they become a better manager across the board, not just for the individual who is autistic. We talk to companies about having a self-identification campaign, right? Like make it really explicitly an inclusive, welcoming culture to bring your whole self to work there. Are there any people in the company who with support might want to self-identify, and that starts to become part of a campaign? We encourage them to do some messaging, and throughout the year, not just one time, some engagements, surveys. The other thing is, in the States, they call it ERGs, employee resource groups. And so many larger companies, and there might be some equivalent in your areas, they have employee resource groups that are often identity-based or on different issues. And so that's a group of people in the company who come together and try to, with support of the company, try to navigate and make, headway and improvement on being more welcoming to and more supportive. And so many companies have that. And the last, we always say too, it like goes back to the diversity, equity, and inclusion issues. If they're not going to include disability and measure, disability and autism, it often doesn't get done. We know that there's accountability. What gets measured gets done. So really looking at what your percentages and stats are, and then, making some goals to improve that. And in the United States, there is, if you're a federal contractor or a subcontractor, there are some regulations that say that 7% of the workforce should be people with disabilities, and that's 7% vertically. And it's not necessarily enforced. A company has to prove good effort to be doing that, but we do talk about things like that with a company as well. So there's some of the things, I think companies can begin to do. And it's a journey, it's not a one size fits all. And we try to meet the company where they are and build incrementally over time with them.
Thank you so much, Dianne. As always, that was extremely thorough and very, very interesting. I only have a kind of few follow-up questions to that, and is through this podcast series, it's become apparent. So we look at things like on-the-job interviews, allowing a neurodiverse individual to perform the role, on the day and being sent the job descriptor, a couple of weeks beforehand. But what's your opinion on this notion that obviously that in itself, if you only allow neurodiverse individuals to perform on-the-job role interviews, and you have neurotypical interviews undertaking traditional interviews as it were, that in itself can be deemed as discrimination. Have you experienced that in your wider work, or do you adopt a different approach where you encourage the employer to blanket it across the board, that if we're doing it for neurodiverse individuals, then everyone who applies for the role should be given the opportunity to perform the role? What are your thoughts around that?
Yeah, it's like I said, it's a journey with the company, and we're in a really it has been a rocky 2022, right? Like in the beginning of the year, companies' hair was on fire. Like you couldn't even get a company to respond to you. It was just utter craziness. And as the year has settled in and there's this new normal of a real war on for talent, companies realize they have to reach out and start to do something differently. So what I'm saying is we can't go in and just dictate what a company does. We don't work there, right? We have to suggest, we have to give them, we have to be responsive to the climate and the times we're in, and recognize that like many companies, they are really struggling, in intense ways. But what we try to aim towards is what we call universal design, right? And so that's where, really good practices, evidence-based practices, or good supports, when people see them starting to work with someone who's autistic, then they go, a lot of other people maybe could use this too, right? Or other people might do way better with this. So I think the universal design approach is the ideal. We don't always go in and tell a company they ought to do that as the first step, because they just will say like, that is too much, see you later. They won't engage with us. So it's a process, right? But that's the ideal, absolutely. And when companies see it working, I think that's where they start to get some traction around it. The other thing is, like I said, in Philadelphia, there are many segments, groups, people who experience a lot of barriers. So we're collaborating with a really interesting group called Ride to Work, and we have a partnership, and they're working with a lot of these manufacturers that are on the rim of our city, and there's no public transportation to get there. A lot of people in the city don't have cars to get there. And we've talked about a lot of the things like we do, like texting the candidate the morning of the interview, sending reminders to the person, working interviews, and like a lot of their candidates would benefit from the same sorts of things. So that's we kind of try to do that, but maybe in a softer approach, because companies shut down when you put too many demands around how you have to do it right from the start. So it's a journey, and we try to give them little incremental steps they can take to get buy-in, and then, blow it out from there.
Yeah, no, I couldn't agree with you more. I think it very much is incremental steps with the business. You can't go and try and universalize the approach, because they will, as you said, there'll just be massive resistance to it. It's too much for the company to turn on its head. But yeah, so I just want to, for my next question, if I may, focus more on the working environment itself and what employers can do to further that, to ensure that their working environments are inclusive, engaging enough to retain those with neurodiverse characteristics.
Repeat that for me again. What the employer can do for their working environment? Is that the question?
Sorry, it wasn't very clear. What I mean by the question is, what can employers do to ensure that their working environments are made more accommodating and welcoming to neurodiverse individuals? So you stated, you gave the example of when the doors closed in the office, and you have, the unwritten rule of the office is that person's busy, that person's, on the phone, so on and so forth.
Yes. Okay, I got you. Yeah.
Wonderful.
Yes. Yeah, so each company culture is so unique and is so different. So for us, a lot of it is trying to make really good matches, is to know enough, like when we're working on the pipeline, match, like what are people's skills, talents, abilities, and then what does the employer need? We always want that individual to be able to really do the work of, do the real work like anybody else. Like that's really important. And we want the individual to have a good match to what that environment is. Like you can't go in and ask, like, so for instance, we just, there's a big food company in Philadelphia, very hip and trendy, and a lot of spaces closed during the pandemic. They're opening up new food service spaces, and they need talent. So we collaborated, and I wanted to source some folks for him, and he wanted front facing customer service folks. And a lot of the individuals for our program went online with some support and applied, but they applied for all back of the house. And so I checked, like, did they know the difference? Was this intentional? It was very intentional, because these folks knew they weren't front of the house folks, right? So like, we can't ask a company to say, like, change what you expect your customer service to look like. We have to make sure a good match is made there. So sometimes I think people get a little confused that, I bring my whole self and I should be able to do any job. Now, you still have to have the skills, the aptitudes, and so on to do that job, right? But a company, what we find too is, so sometimes companies won't understand the role of job coaches, and they'll start talking just to the job coach rather than the individual. So we want people to be treated with the same respect that every other employee is, and held to the same standards, and communicated with in similar ways that other employees would be. So that's really important. And along that same line, we want people to have the same kinds of opportunities as everybody else in that company. So we find all too often people with disabilities, they assume, oh, that job's their good fit, they can just stay there forever. And we have people working in a very entry-level job for 8 years, never within that company, who prides themselves on career pathways being considered for, for any promotion. So we think that companies, like, that's a pretty easy, like, apply what you do for most people to anybody else with a disability there. I think companies also need to make it really clear how you ask for accommodations and how that process works. And there are laws in the United States guiding all that, but we talk to HR, human relations folks in the States all the time, and they get all nervous about, well, what can I ask and what I can ask, and so on. So those kinds of processes should be very apparent in a company. So if you need noise canceling headphones, right how to ask for that. Any sort of accommodations. And employers need to understand that many accommodations are low cost, easy to implement, and often, if universally done, improve the workforce for everybody. But sometimes there's misconceptions that they're expensive, they're really timely, they're hard to implement, and so on. And then this might be a unique thing to the States. I don't know how this plays out for you, but many people with disabilities in the States have received Social Security insurance or Social Security disability insurance. And there are huge perceptions that when you receive those government benefits, you can only work so many hours. It's going to jeopardize your benefits. And that it does influence your benefits. But what's missing so much across the states is this benefits counseling that is individual to the person being employed and their family. And we have a team of certified benefits counselors that ensure that that individual can safely come off of some of those government benefits, often cash benefits, and bring more money into their household. And so when we do that, what we're trying to do is set that person on a trajectory of full-time work, self-sustaining work, where they become a taxpayer rather than reliant on public benefits. But those common myths also exist on the employer end as well, that the person really just needs part-time work.
Thank you so much, Diane. That was extremely insightful. Yeah, and I think it really harks back to that notion that, you can't do sweeping statements in offices. There are small, tangible steps. And I think what's come out as well from this podcast series is when you're speaking to HR, officers, as it were, and you're asking about, their lack of willingness to communicate with neurodiverse individuals, I think what we often forget is the first port of call should be always to ask the individual. You can do all the academic research, you've gone all of the courses, you know what support is and should be available, but I think some people get bogged down and just, missing the individual, forgetting that it is a person behind, all of that.
Right,
What do
right,
they want?
totally, totally.
And but it's a very difficult argument. It's what happens in one office could be, some office, other office doesn't have the financial resources to implement some of it. It's case by case basis, but there are small steps. But I think the first step is to always to ask,
Yep.
what can be done or should be done.
Right. Yeah, and I think creating some safe spaces and some go-to people. So a lot of companies will do some sort of mentorship, and that's a good model across the board. Like Drexel University is a very complex system to work within, and you need a lot of alliances to figure out how to navigate all sorts of stuff. So that's magnified again when you may be autistic. And so having some mentorship programs that are really built in structurally, so it really happens seamlessly, and it's not like we're trying to create it as soon as someone arrives or reinvent it, I think can go a long ways too. And those ERGs, the employee resource groups, can do a lot around that kind of stuff.
Yeah, no, I think it's this conversation is going to be vastly beneficial. Our wider work is, I may have already told you, we're currently in the process of coordinating our own initiative on the same ground. So the first port of call, as you mentioned, is that a lot of neurodiverse individuals in the United Kingdom, particularly during the pandemic, completely fell off the radar. They're very isolated at home, be it with their families or if they're living by themselves. But they lost the ability to to go to the shops by themselves, to go to the cinema by themselves. So what we're hoping to do in the United Kingdom is first and foremost on the employment limb, have a buddy scheme implemented whereby my volunteers will go into their homes, they'll buddy up together, they'll start going to the cinema, to the shops together, just to get out into society again, to feel comfortable, to integrate again. And then from there, we're going to be running CV application classes, job application classes, interview prep classes. But most importantly, they're also going to be the buddy is going to be the contact point between the neurodiverse individual and the employer. But I think what really stood out to me was we must remember that it doesn't become a one-way conversation between the buddy and the employer, between the neurodiverse individual's needs. It has to be always, the buddy steps in at the most poignant moment where the need is so apparent, but really the communication is always to call the person, the individual, neurodiverse individual themselves, on that, to get their take on the matter, and if that doesn't unfortunately prove fruitful, then to contact the buddy, and not to use it as a scapegoat to
get exactly. It's similar. We don't have it's not a buddy, but similar. The other thing we've added to those kinds of things is we launched we call it the Philly Wins Hub. It's the Workforce Inclusion Network. And it's in a community space that Drexel runs. So it's like even more deep into the community than the campus, which I said is already this urban, setting. And it's an interactive space that supports job seekers with disabilities or other neurodiversity, whether they have a diagnosis or not. So Philadelphia recently did this really interesting interactive map that maps out how many people with disabilities based on the census are in our city. It's 22% of the population. That's probably underreporting. It represents 250,000 adults. Like, it's huge. And so this hub is a spot that people can come into. And what we think is missing in many times is they can do a hands-on assessment to see, like, for instance, we were just working with a small electronic manufacturer, and they wanted to get a number of candidates to interview. And so how do we know that someone can really tinker, like, with wires and do that kind of work? Well, we brought them into the hub. We had actual assessments. We measured the time, the aptitude, how much they enjoyed it, and then we could recommend various candidates to be interviewed there. So that really assessment of what the skills are, and then we're building out additional assessment tools to use, because we think that's so many times missing for the individual to realize, like, we want in workforce development in the States now, everything is about uptraining, upskilling, and that's needed. There's no doubt, but people also need jobs right now with the skills they have. And so we're really focused on trying to do that. And then in that process, we work on their resume or their CV. We help them with interviewing skills. We also do all the wraparound. So huge issue for so many people is childcare. They don't have childcare. They don't have transportation. There's food insecurity. The list goes on and on. So we try to do all that wraparound support so they're actually ready to succeed in that job when they get it. And even just having a state ID having the required documents you need to produce when you get a job. We work with people to get all of that. And we have some ability to stipend, give people like, small cash checks each time they meet some of these incremental goals along the way. But we found that that's really, that knowing what the skill set is right now really helps place people in jobs that are, more targeted and hopefully pay a little bit better and are more self-sustaining and set on a career pathway for them.
Yeah, no, I couldn't agree more. And I think I'd just like to hone in on the point that none of this is new. These services were already being provided to neurotypical individuals through recruitment agencies, and so on and so forth. It's just about making those facilities which are already available a bit more specific to neurodiverse individuals. It's not, in a sense, pioneering work. It's already being done. It's just about making it a bit more specific and relatable to those with, maybe more complex needs, as it were, to put it.
That's right. So in our city and in the States, there's a lot of workforce development, tons of funding that goes into, getting people, the individuals ready for employment, like because they experience all sorts of things. But what we find is that it's a very light touch. So like they just tell people where the job interview is. That person who really needs very explicit directions or support doesn't ever get there. It's that on-ramp again that's missing, that sort of wraparound support and on-ramp that's missing. And that's where we try to be more robust in some of that stuff than those systems that exist.
But it's so, it's so easy for a company to implement these services. I mean, a lot of companies, large companies already have buses, shuttle buses between certain points in the city and their work premises. And I know for, a smaller employer, small to medium-sized business, that may be a huge undertaking. But, you can still provide maps, the best tube links. I mean, a lot of companies offer this on their website anyway of, under the How to Find Us tabs. But it's just making it more accessible to that neurodiverse individual from their home. And, they will follow it once they've learned the route, that more often than not, they won't deviate from it. It's like all of us.
Exactly. Yes, exactly. Yep.
Brilliant. Dianne, I think if you're okay, should we leave it that question there for now and move on to the next?
Sure, yes.
Which we've already covered in quite a lot of ground, but that is what regional or local support is currently available to those with autism or neurodiverse characteristics who are currently seeking employment in your local area? We've spoken about a myriad of organisations and businesses you're currently collaborating with, but is there anyone else that you'd like to add on to that, or any company you wish to discuss?
Yeah, so there's a lot going on in this space. There definitely is. And, so on the disability end, we have all this supported employment that supports people one by one. And then there's a lot in Philadelphia and in the States around autism at work, neurodiversity at work. And they really are influencing the conversation and shifting. We do find that sometimes those initiatives, not always, but sometimes they are hyper focused on specific jobs or industries. And so what we're trying to do is with our Business Inclusion Center is really, broaden the industries and broaden the types of jobs, like I said, and then do that support on both ends. We find that that's sometimes missing, like, it's just supporting the business or it's just supporting the individual, sort of marrying those, is where we think we get really good outcomes there. And then, the work that the work that we're doing in the school to work transition stuff is really, really crucial. We do find that connecting, to the next phase. Like, so for instance, we had we were doing interviews for our school to work transition programs, and a young man came with his family. He was only 16. You need to be at least 18, have completed your high school requirements. But that year we had an initiative for summer employment, because one of the things that's so important is early work experiences. This is true for all youth, but it's particularly, autistic youth rarely get that on-ramp to those opportunities. So we had a really awesome program for a number of years, getting autistic youth fully employed in the summer, totally inclusive employment. And this young man did that. And then he came back to us at 18 and did our school to work transition program. So that last year he was out of the school, based at Drexel, doing internships, doing everything. And right as he finished his school, even in the middle of the pandemic, it was the first, spring of the pandemic, we got him a job in manufacturing. Wasn't a fabulous job necessarily. It was fairly low paid, but he did awesome and he stuck with it for about a year. So we looped back with him. We had a new employer. He got about a $5 an hour raise on his second job. And that's the kind of, trajectory and story. Like we so many times people, get hyper focused on an intervention or a program. And, no one program helps any young person, move through the trajectory to their career, right? It's a set of things that happen over time. And I think the more we can sort of do those things in intentional ways, and it's through partnership, like we can't do all those things directly, but we can help. Like we had a contract this summer for the big Work Ready initiative in the city for all youth. And we're talking to them. Are you creating that on-ramp for youth with disabilities to get employment in your systems? Like they're here too. Who are you missing in your communities? Like who's there? So we're trying to work sort of systemically across systems. So all these systems, like my ideal is that, because I have my oldest daughter has a disability. I've been a huge inclusion advocate all our life. Like I had 3 little girls. They were like my little ducklings. If we're going to swim lessons, they all went. If we're going to school, they're all going to go. Like I didn't have time to go to the specialized this or the specialized that. So I think the more whatever is happening for all youth and young adults, we need to make sure those pathways are supportive and those on-ramps are there for autistic youth as well. And so it's really collaboration and coordination across all these various systems. There's no one thing that could ever do it in any city or any nation. I think it's, building capacity across so many of these things, and business partners are crucial in all that, right? If they start hiring the young folk at 16, 17, and then those the businesses learn so much as well as the young autistic person. Because what I hate to see is Drexel, I'm not in charge of this program, but they also have a program for the students who have applied to Drexel who are getting degrees who identify as being autistic. So many times they are exiting and haven't had any work. Would you really want to start your career with a degree, never having had the job where you learned how to call your supervisor and say, I'm not feeling well today, like all those skills that people learn in those early jobs? So I think, I mean, I don't know how much that answered that, but that's some of the things so we sort of touch base across our city with all sorts of things going on, including workforce initiatives. That's the big area where the money is generally for neurotypical people. And we really are working with those systems to say, how inclusive are you and what are your on-ramps for people who need a little bit more, and how can we collaborate to really think out of the box and do that. And it's hard. It's not overnight stuff, but I think that's where systems begin to change a little bit. And, hopefully our communities become more inclusive and responsive to the real people living there.
Thank you very much. I think you answered that excellently. The only commentary I really have from it is you mentioned, I think, as I envisage it, those, myself and yourself, those who are trying to enhance the opportunities, employment opportunities for neurodiverse individuals. I very much view myself as a recruiter for all industries. Or, you've got to remember, every individual is different. One individual may enjoy science, one may enjoy arts, so we can't just be running employment programs around channeling those into the fast food industry, just to use it as an example. It's really about meeting the individual, learning what they enjoy, what they find interesting, and then trying to marry them up with a suitable job role that suits them down to the ground. In other words, this is going to be we spend most of our life in employment in our adulthood, and so they're going to be there a lot. So how they have to enjoy the role more than anything. Can't just be employment for employment's sake. But there's other considerations thrown in there as well. As employment is the bedrock to renting a house, having a car, going on holiday. It really is the crux of adulthood, as it were.
I will, if I can interject for a second, though. What we do try to do is, I think sometimes, though, it can become so hyper focused on the individual and their desire, dream, job that then it ends up with a job that's a couple hours a week because there's really not openings there, or there's a skill match or whatever. So we do a lot of work, and one of our big shifts has been to really talk about what is out there in the market, like a market sort of driven approach to this. Like, I have 3 young daughters, and the other 2 were like, what are the jobs that are available? What do they pay? And what skills do you need? And like, you may have to start in a job that's way less ideal than where you're aiming to get to. So let's talk about what that career trajectory is and what sort of skills and gaps you may have in there. And sometimes we have found that the conversation with people with disabilities has been in this realm of their dream job way too much. And where what they really need is like a job that's entry level, that you work hard at, you get a good reference, and you get on to your next job. So we've tried to like shake that up a little bit so that people really can incrementally launch a career. And we have some really good websites in the States that can show you, if you have these skills, this is what you pay. And if you upskill to this, you'll get paid this much more. It's like more concrete than just, like my daughter wants to be an actress, but she's working in an office right now and does community theater. So like, and she loves them both now. So that's some of the conversations and tools that we try to build in to the programs and processes as well.
Yeah, no, it sounds like you're doing some truly excellent work. And I do think, yeah, as you said, you can't focus on that dream job. You can focus on an industry or a sector that you'd like to work in and have a role in mind within that. But everyone has to start from the ground up, as it were. And I think, yeah, an entry-level job will lead on to greater things. You're in employment. So yeah, Dan, if you're happy, we'll move on to the next question if I have for you, if that's
Absolutely.
okay. Really, it's just this is looking more towards the kind of the policy changes, the governments around the issue. But the specific question is, what lessons or best practice methods have you taken away from your projects and research that you believe could help to address this employment issue on both a national and international level?
Yeah, that's a huge question, right? I think, when I started in the position I'm in, we had a generous donation to fund a small team. We're a small team. We're like 5 or 6 people. And I could have just blew through a budget, found the best evidence-based approach, set up a program, and blew through my budget and spend all my time fundraising. And we would run whatever, right? But we saw that there was first off, you're in the school system, and the school system isn't talking to the adult systems, and none of those are talking to workforce, and none of those are really talking to business. And where do other nonprofits and for-profits come in, right? So what we've baked into everything we do is, rather than running many things just ourselves, we see ourselves as convening partnerships to really try to create initiatives, programs, and so on that start to move the needle, but in the process, shift how these different systems are working. And so I guess what I'm saying is, after having done this for, it'll be 6 years this fall, I'm in this position, I think we talk a lot about collaboration and partnership, but at least in many of the circles I'm in and in collective impact, what's oftentimes is missing is really funding somebody to help guide and steer that boat in that, right? Like, you ask to be part of all these initiatives, and people are like, we're doing it because we love this work. We know it's on top of everything else you're doing. And it has to stop being on top of everything else and be the work and be funded somehow as well. So I'm saying, like, the role that we play, we convene all these partners, like with our school programs, we have the school district, but we also have vocational rehabilitation, which is the adult funding system. We have the Medicaid waiver adult systems as part of our partners. And then we have businesses. A school teacher can't manage, guiding all those partners. So we come in and we play that convening role, and we guide and we set the agendas, and we fund things that there's so many times something wouldn't happen because no one had $200 to like give people trans passes from here to there. We plugged the holes, when there's holes, and we keep setting a vision of where we can go next and build more and more and deeper partnerships. So I think particularly when we're talking about young adulthood and youth moving to employment, if we could really build these robust cross-sector, cross-system partnerships and fund, the work of working that way, like in partnership, like that takes effort, time, and money to do that. Then we start to see systems change more and more, and not just assume that people will do that work, at midnight and on Saturday because they're passionate about it. I think that kind of deep, ongoing, years long, like our thing with the school district, we're going into year 7. And what starts to happen is not just the programs that we're helping direct and fund, but they've started to back map, what do students need to be ready for these programs. So it started to have this ripple effect. I think, we also have to try to measure, which is really challenging funding wise and every other way, what all the ripple effects of that kind of working in partnership and in collaboration can produce.
And I think just to add on to the funding side of things, I think there's always a tendency amongst grant bodies and so on, particularly in the United Kingdom, to fund certain types of projects. So if there's going to be employability of neurodiverse individuals, that may have a focus on the art sector, or it may have a focus on manufacturing. And as we've just spoken about, it has to be open-ended. You can't just work with individuals who have an aptitude for the arts or an individual who has an aptitude for science, perhaps, and I think that's where we're slightly falling foul. It needs to be much more on focus, needs to be much more on project deliverables. Here's the funding to enhance the employment opportunities for neurodiverse individuals, and then the grant body then takes a step back, allows the organisation to fulfil that mandate, but in an open-ended manner, rather than trying to go along the tick box exercise of we've managed to do so and get so and so many into the creative arts, whatever it may be.
Well, the funding and grant making stuff is very, very difficult. It takes hours and hours and hours of time and focus, and often it is very, very specific, and then they want grandiose outcomes for very little funding.
No, I agree. From my personal experience, I can relate to you entirely.
Yeah.
But I do think, particularly in the UK, we'll be pushing for much more, funding from the government, either directly to organisations or indirectly through the to the neurodiverse individual in order to obtain the services. But I'll leave that point. All I should say, though, for our listeners as well, is if you do want to help us, we will have template emails and letters available on our website where you can write to your local Member of Parliament in order to express your desire for there to be more funding made available to neurodiverse individuals across the spectrum through the various avenues of work that we undertake. So anyway, with that being said, Dianne, my last question to you, as it was scripted, as it were, is very open-ended. It was, is there any other matter that you wish to discuss? I always like to rephrase this question, as it's the last question I'll ask you today. And that is, if there was one message that's going to come out of today's discussion that you'd like our audience to take away, what would that be?
Oh, wow. Well, I think the time is now, is what we keep saying to everybody, right? The time is now. We've had so much disruption in our day-to-day norms and in employment and so on, that in the United States, like 37% of people with disabilities are employed, compared to at least 60-some% of the general population. This hasn't changed a whole lot for really decades. And so if we don't change, if we don't act on this moment of disruption now in really significant ways, we're missing another generation of people who are going to be underemployed, unemployed, and really regulated to lives of poverty. And so I think the other thing we tried to talk about is that there are social benefits to this. Like when I talked about the young person getting that benefits counseling, and we have individuals who have been working. The first year I was in this job, they got employed at the Philadelphia International Airport. We built an on-ramp for them, and with benefits counseling, they were able to come off of the cash benefits and maybe other benefits because they're full-time city employees. They've had all the protections and so on right through the pandemic. And so you talk about the trajectory of a young person becoming a taxpayer and what they earn over the course of their life, as opposed to the trajectory of relying on government benefits. Like, there are huge societal reasons besides the individual reasons to do this. And then I think for businesses have, I know it's a hard moment, but it is an investment when that on-ramp might be a little bit longer for an individual. We help with government and tax incentives that can offset some of that longer training period. And we help companies leverage that money that really is real on the job training dollars. There's a bunch of government incentives, but it might be a little bit more upfront work for the business, but they have to realize they're investing in that long-term return on investment, because that employee will be well worth it. And then lastly, I would say is that, every time we go and talk to an employer, we'll say, who in the room has someone in their family who's autistic or knows someone? Like, everybody does. And so wherever you're employed, maybe there's an advocate already in that company that you could start asking, what is our commitment to an inclusive and diverse workforce? What are we doing? And start that conversation from whatever position you may sit in. And I think that's the kind of ripple effect that will really help us move that needle on these outcomes for, way, way more people.
I couldn't agree more. Dianne, thank you so much for taking the time out of what I know is an extremely busy schedule to be with us today. It's been absolutely wonderful having you on. I just have a few concluding remarks, and that is, this podcast has been brought to you by the Sikh Human Rights Group. For more information about Ms Dianne Malley and her projects, or the Sikh Human Rights Group's projects and policies, please visit our website, the link to which can be found below within the description to this video. Or alternatively, please visit our social media accounts at SHRG_NGO. I've been Class Arbuthnot. Thank you very much for listening.
Thank you very much.